Hello and welcome to our broadcast. I'm your host, Meredith Cunningham, Media and Community Relations Manager for Covenant Health. Joining me today is Tavia Hatfield. She's our Regional Director of Community Health Investment for Texas, New Mexico, and also our Regional Chief Executive, Walt Cathy. Thank you guys for being here with us today. Let's go ahead and get started. And today we're talking about the community benefit programs that we have going on here in the Texas, New Mexico region. But first, before we get into the nitty-gritty details, let's first hear a little bit about what both of your roles entail here at Covenant. Tavia, let's start with you.
Sure, yeah. So as Meredith said, I'm Tavia Hatfield, and I am the Community Health Investment Director for Texas and New Mexico. And I have been in this role about 10, 11 years now, been with Covenant closer to 15. And in this role, we really focus on investments into our community. So through working with nonprofits and community partners and schools, and also offering direct programs related to community benefit and community outreach. So as a part of that, we do a needs assessment every 3 years where we talk to the community. We pull up both primary and secondary data, and we really try to find out what the most important needs that we have the ability to address within our health system or partner with others to address. And so that is the focus of our work is finding ways that we can meet those needs and support our community.
Perfect. Can't wait to learn more about that. And Walt, tell us a little bit about what you do.
Yeah, so my title is I'm the Regional Chief Executive for Texas, New Mexico region. We cover a geography basically the size of the state of South Carolina, but it's only about 1.2 million people on our geography. So it's a lot of rural environment, but Covenant really does a unique job in kind of how we cover that geography, both in West Texas and Eastern New Mexico. We have, several hospitals in the city of Lubbock. We have a hospital in Plainview, a hospital in Levelland, and then we just did an acquisition of a hospital in Hobbs. And so we're really still growing and expanding our footprint from how we can hopefully treat and better the community needs out there in the overall area. For me, I've been in this role for 5 weeks. But I have been with Covenant for 24 years, so this is definitely my home.
Perfect. Thank you both. So let's go ahead and get started and talk about why does Providence, and specifically our region for Covenant Health, participate in community benefit programs?
I think Covenant's a Christian-based organization. We both support the Catholic ethical religious directives as well as the Methodist faith-based doctrines as well. And for us, it's really important. If you look at kind of what the sisters started us with, they talked a lot about going out into the community, finding a need out there and solving the need. That's really what healthcare is supposed to be about. And we're still trying to live to that even today. Healthcare is and always will be a service industry, but how we deliver healthcare is really important to us as a differentiator. And so we do a lot of surveys where we get community benefit needs back to us, and then we go and really talk to a lot of our partners within the community and really find opportunities about how can we better healthcare environments, influence financial support of different models that are out there to really drive the wellness of our community in a positive manner. And really that's what's important for us. We want to service everybody. That's what we're about. But really making sure that our community is taken care of holistically. And then we're really taking care of those in need is really important to us.
Tavia, would you like to add anything?
Yeah, no, I would just, echo what Walt has said. It's a part of our true mission. It's a part of our heritage and our legacy that we do this work. The Sisters of Providence and Sisters of St. Joseph, both originally started reaching out to their communities, talking to the neighbors, seeing what the needs were. And while we do that in a little different capacity, we're still doing that. So I really feel like it's just who we are and what we do. And again, as Walt mentioned, we work with those community partners. We try to identify those needs. And, I think one thing that I would add is I think it's important that we're looking at as a health system here in Texas and New Mexico, and really as a whole with Providence, not just at the healthcare needs, but also the social determinants. So those are things like housing, food insecurity, education, safety, even building sense of community and belonging for the folks that we serve, because we know those social determinants are really core and key to having a healthy community and to preventing some further needs down the road with people in the future. So that's a big part of what we look at as well.
So really getting to the core of what's causing those health issues.
Yes.
That's great. All right. So our next question is, what are some of the highlights from the community benefit programs that we have going on? Let's start with you, Tavia.
Yeah, so in our most recent needs assessment, which we actually completed in December of 2020, which obviously with that timeline was a little bit different than any we've ever had before. With COVID, we had to get really creative about how do we talk to our community and how do we still gather this information. But we were able to do that, I think, quite well. And the priorities that we kind of saw bubble to the top based on that most recent needs assessment are behavioral and mental health. And underneath that, it's kind of including everything from treatment, intervention, prevention with all ages in our community. And then the second big priority that we saw was access to health services. And including in that, and under that are some of the things I mentioned regarding those social determinants. So it's access to healthcare services, yes, but it's also access to mental health care, to community navigation, to healthy food and education, and how do we really reach out to our kids in schools and our seniors, and everything in between. So I think sometimes people kind of typically think of health access as buildings and building new places, but that's not always the case. Sometimes it's taking those barriers out or helping address those barriers that people are facing that make it hard for them to access care or to have a healthy environment that they live in. So that's another one. Our third one is housing and homelessness. So we've done a lot of work this year around supporting, in particular, veterans homelessness and how can we help our community to achieve as low, if not zero, homeless veterans. And so we've worked closely with community partners like VetStar and the VA and several other housing agencies. And then our fourth priority this year was food insecurity and nutrition. And so with all of these, in addition to working with partners, we also run direct programs, which I think is something that's really unique and different about Covenant Health. You don't see that all the time when you look at health systems across the nation. So we run a direct program for access to care around mental health. We have a community counseling clinic that's dedicated to providing counseling access to those who are often the most vulnerable and uninsured, underinsured, and also people who live in the region and may not have any of services like that in their small community. We also do a dental outreach clinic both in Lubbock and in Plainview. And that's the Plainview dental clinic in particular is a fantastic partnership with their health department. And so that's been a newer program that we've been really excited about. And then with, I mentioned with the housing, we've been working with a lot of community partners and providing funding and in-kind support and wraparound services. We have a care management team that goes out into the community, meets people where they are, and they do that for people who are housed and people who are not housed, and try to provide those wraparound services and help support connections and do a lot of social work. And then with food insecurity, again, we have our health education program, and we work closely with Catholic Charities, and we work closely with several other agencies to help provide food vouchers. We work closely with the YWCA, providing health education, and the Dream Center, which is a nonprofit here in Lubbock that's connected with a church. And so just lots of different ways that we try to address these things and run both direct programs and also provide financial and in-kind support to our partners.
A lot of great initiatives going on. Thank you for that quick roundup. I know there's a million more things that we do.
Yeah.
But Walt, I want to ask you, Tavia mentioned multiple times many of our community partners. Would it be possible to do all that we do without these partnerships?
No, absolutely not. When you talk about a community and we talk about how we interact from a faith-based institution, The only way to make improvements inside of our communities is for collaboration, and that's really what the core has to be about. Within Covenant, I think this last year we kind of gave away and really donated out there roughly $76 million of community benefit care for our community, which is a pretty good substantial amount of money. We tithe 10% of our net revenue to the bottom line that goes back out into our community through these community services, and really kind of spearheads a lot of the work that Tavia and her team gets to do out in the community for us, and really kind of helps our community out overall, because there's a lot of financial gaps out there that we get to fill from that perspective, and we bolster a lot of the community needs through that. But it also helps us bring other people together to really solve community needs out there, and figure out unique ways for us to address some of these barriers that we have. I mean, that's what our job's supposed to be about. It is really in healthcare, how do we improve health? Not just waiting for you to come see us, but that means that we are going to need to partner with people and collaborate to do a better job of that overall.
Great answer. Tell me a little bit about how philanthropy and giving back is part of Covenant's mission. We already mentioned the sisters, but let's dive a little deeper into that. Walt, you can start. Or Tavia.
Oh, sorry.
Sure.
Sorry.
As soon as I mentioned it, Tavia, you can go.
Okay. I would just say, and I think we talked a lot about, different investments that we make through providing grants and contributions and donations to our community partners. But in addition to that, we also provide a lot of in-kind support. And what I mean by that is our employees do a lot of volunteering in the community on behalf of Covenant. In addition to that, through our programs that I mentioned, we actually place employees, caregivers on site in some of these locations to help fill gaps. So a great example of that is both with Catholic Charities and with Lubbock Children's Health Clinic, we actually have staff, caregivers who go and serve on site in those locations. And that is providing in-kind support, which is essentially financial support that prevents those agencies from having to hire additional staff. So we're able to share, some of our staff time and our expertise with them. And I think that, again, is just a core piece of our mission and investing back into our community. And then the last thing I would say is we also are very lucky at Covenant to have our Covenant Foundation and have a great partnership between Community Health Investment and our Covenant Foundation. They, their whole job is obviously, to fundraise and to find ways to support Covenant and to work with our community donors. And they've been excellent at helping us in community health investment when there's gaps that maybe it's something that we don't have in our budget or something new that has come up. For example, last year with COVID, we didn't plan for all of that in our budget. And so we were able to partner with the foundation to provide some extra support for some COVID outreach, for education outreach, for supporting United Way, both here in our Lubbock area and also in Hobbs. So I think our philanthropy department, our Covenant Foundation is a fantastic partner and really also focuses on that mission of how do we support our own caregivers and our own work, but also how do we support what they're doing in the community.
Walt, what do you think about that connection between our mission and what we do?
Yeah, for us, it's vital. If you talk about, what we're doing really today with YWCA and how we're really trying to influence our kids population within our community and really see if we can actually change over the healthcare norms that are out there, how we deal with food, from a child perspective and how that actually benefits them from an adult perspective, to decrease comorbidities and all those type of things. I think it's extremely vital to really start intervening earlier and earlier in kids' lives to really drive healthcare changes, because maybe if we actually are really successful in our jobs with this thing, they may not need us in the future. And so I think that's kind of all of our goal is to see if we can actually get out of our own jobs sooner or later.
I want to follow up with a personal question for both of y'all. Obviously, our organization has a connection to this mission, but it would be hard to do what both of you do on a daily basis without your own personal passion for these projects. So, Walt, we'll start with you, but what is it that connects you personally to this mission?
I've been in this community for a long time. I came here to Lubbock to go to school. I started Covenant roughly 4 months later. This is where my family is. This is where my girls go to school. Making sure that this community is taken care of and really seeing the impact through all my years of being a Covenant and what we have in this community. It's special. I mean, there's not a lot of places that I've ever been around that have this type of impact in their community, and we hear it all the time. And I think we're extremely blessed for what we do inside this organization and how this ministry actually services the community. And so, you know, I think more in probably my role, and I think in Tavia's role, because we're both out there a little bit more in the community than a lot of our caregivers, we get to hear that constantly, and people constantly come up and talk about how Covenant, has impacted their lives and impacted their families' lives. And it's all the little things that we do, I think, that really makes up what Covenant is and why we're so special in a community this size. And so, yeah, I definitely think, most of my family being here and the impact that we get to see is absolutely amazing to know that we have an impact.
Tavia, what about you and your passion?
Yeah, no, I think Walt said that really well. And a lot of what he shared, I would agree with, and that resonates with me. I grew up here, and my family largely are here, and my children. And I think that, working to make a better place and a healthier community, and how that connects back to our most basic pieces of our mission. Serving all without distinction, serving our neighbors. We're all neighbors. We're all part of this community, and trying to make our community better and more healthy for the upcoming generations is super important. And so I think, that's Walt said Covenant, I think, is very special in that way, that we are very ingrained in our community. We are very connected. We're not just waiting, we're not just a hospital that's waiting for people to come to us. We're really getting out there and trying to see how we can help. We've got a lot of great connections with our school districts, so that we can, connect with younger students, younger children, and their families. Sometimes even more importantly, these young families who maybe just need a little bit of help to get ahead in life, or to be able to provide some of those services to them. So I think that's awesome. And I think another thing that we do really well at Covenant is we have a lot of our own education opportunities, and we have a nursing school in collaboration with Lubbock Christian University. And so, a part of our investment too is bringing up new leaders and bringing up people who hopefully will come into healthcare and continue this legacy and continue working to really make that mission alive in our community.
David, you bring up a great point. I'm actually going to circle back to that right now. You mentioned the Covenant School of Nursing, but Walt, I want you to expand on our partnership, not just with them, but also with Texas Tech University and all of our programs for our medical leaders. Because Tavia is exactly right. We are literally training the future doctors who are going to take care of our community. So can you elaborate on that, Walt?
Yeah, we talk a lot about collaboration. You've heard us mention that over and over in this little segment. Covenant's a great ministry, and we have great healthcare systems that we provide inside of our communities. There's no doubt about that. But I think we also are a little bit realistic. We know we can't solve everything inside being a health system. And so having those collaborations is vital, whether it's with the YWCA or with Texas Tech on different endeavors. And, I think one of the things we really have been priding ourselves on is our partnership with Tech and the growing partnership that we have with Tech. We have somewhere in the neighborhood of 60, third and fourth year medical students on campus. We have over 30 residents on our campuses to really kind of train the next year's leaders. We do a lot with the allied health program over at Tech, to where we can train PTs, OTs, speech language pathologists, all those various things, including medical lab science personnel. It's really important for us. Lubbock's a unique environment. It kind of resides in its own little island, just with a lot of desert around it. It's not a lot of water.
It's called an oasis, Walt.
Yeah. So I think it's important for us. If you look at a lot of the studies, they say that if you train residents, most of them stay within 90 miles of where they're actually finish their training. And there's just not a lot of opportunity outside of Lubbock. There's a lot of really good rural healthcare communities out there, but if you really want to get into the subspecialty market, you're gonna have to be in Lubbock, or you might get to go to Amarillo, Midland, Odessa, or then you're gonna have to go to the metroplexes on the eastern side of the state. And that provides us a unique opportunity to train and train them inside of the mission work that we do inside of Covenant. And I think that differentiates us significantly. The fact that we talk about our faith here and we lean on our faith here every day that we do care. I listen to a lot of our doctors and talk about how that influences them to stay inside Covenant. And once they finish their graduations, they want to do that because they can see that natural intersection between health and healing and faith. And I think that's important for us to keep, expounding upon that and growing that for our own community and culture here.
So let's continue the comparisons and let's talk again about our sisters and what they were able to accomplish when they first started. And then how does that compare to what we're doing today and what we're trying to accomplish? Tavia, take it away.
Okay. I think it's interesting when you look at, and I mentioned this earlier, but the sisters really went out into the community and said, "What can we do for you?" And so that's when you compare that to what we do today, we still follow that same process. So, we don't sit in the hospitals or in the clinics and say, "Here's what we think the community needs." That'd be pretty easy to do. And because we are such a close knit community, we might be pretty close sometimes in what we think those needs are. But I think that is something that we continue to do, just like the sisters did in early times, is go out and ask, what are your needs? What do you need? And then look at our resources, look at what we can do. As Walt said before, we know we can't do it all by ourselves. And that's one reason why we set priorities. I mentioned our 4 priorities as a part of our focus for the next 3 years based on our needs assessment, and that's in our annual report. But those are not the only needs in our community, and we know that. Those are just priority needs that we heard from the community that we also can match with the resources that we have and expertise that we have. That doesn't mean that we are not invested and interested in the other, 5 or 10 or sometimes more issues in our community. And I think that is, again, something that was done early on with the sisters, is they look at what are the needs, what can we do, what resources do we have, what expertise do we have, or do we need to build, right? So do we need to invest in certain things so that we can create those expertise? And we still do that. And then again, just find, where there are areas that maybe it's not a place for the hospital to be able to take the lead, who can and who can we help support to do that? So I think that those are important things that have been done since the beginning of this ministry, even before it was really a healthcare ministry, and things that we continue to do now, and hopefully we'll pass on to the next generation of leaders to be able to continue doing those things and really meeting the needs where they are, and finding ways and being creative and innovative, but also knowing we have to partner. We're not a silo. We can't do this alone.
Walt, anything you want to elaborate on?
Yeah, I think one of the things that has always really stuck with me about the sisters is, when they came over from Europe, their real passion was around education, the Western frontier. And then when they actually got into Eureka, California, at the time, that's what they were doing. And, that's what the community really needed help with at the time. And that's where their passion was. And then, unfortunately, the flu epidemic hit and the needs changed and their processes changed. And that's how they actually entered into healthcare. It wasn't that it was a great business model, or it wasn't that, this was something they were just dying to do. That's the need at the time. And I think that's what's unique about those ladies. And I think that's something that we try to aspire to all the time. Is it's great that we're a healthcare industry now, but what are the needs out there, and how are we going to tackle those? How are we going to continue to deal with this surging mental health need that we have in our community? And who are the partners that we really need to make sure that this is successful? Because we can't do it all, and you really need to find out who are you going to be your partners, and who's really to kind of really invest in this and change the normative nature of how we live to make an impact. And I think that's really important. It's a great lesson to always kind of, for all of us, to keep in the top of our minds that just because what we're doing today does not mean it's what we need to be doing tomorrow. And we better be willing to change because the needs change out there just as fast.
And that's a great lead into my next question, which is when you do identify new areas of needs in your community, how are we able to meet those needs? How do we create a new program?
Debbie, you want to do that one?
Yeah, absolutely. So, we definitely shift and create new programs and create and look at different investments as needs change and new needs arise. And, I think that that's one thing that being part of a large system with Providence Health is very helpful because when we're creating new programs, we definitely look at, what are best practices, what are evidence-based practices, and we have access to a lot of experts across the nation because of our size. And I think that really helps us as we craft those new programs or new ways to address things, new strategies. We also have a fantastic board here at Covenant, and we have a great community benefit board committee. And we pull in experts from across our city and across our region to serve on those committees and boards. And so they bring a lot of expertise as well. So when we're creating a new program, we're looking at a different type of investment, we get a lot of voices at the table that are helping us. And so that I think is a real strength for us when we're working on new ways to meet issues. And there's really no better example. Walt mentioned the flu epidemic, and here, the last 18 months we've been facing, off and on surges with COVID, and that's been something nobody could have necessarily planned or known would go on as long as it has. And so we've really had to rely on expertise and best practices and our community partners to say, how do we keep supporting this, and how do we help our community through this process? So it's definitely always changing, but we really rely on expertise of this vast system that we have and that we're part of.
Yeah, I would say, I think it's really important to really understand the intersection we have, with Tavia's team looking at all the best practices based on the community needs assessment and how it actually flows all the way up through our organization. So community benefits only one of 5 of the subcommittees of our board. That's how important it is for us. And then really we talk about it at the main health system board, and we make sure that we're all on the same page about where we're funding sources or what new services we're trying to create, and all those type of things out there to make sure we're constantly having our eye on what the community need is and how we're going to start solving those each year.
Well, this is my favorite part of the conversation, and that's always the look ahead of what we hope to achieve. Obviously, Walt, in your new position, you said 5 weeks in here, but then Tavia also has some great experience in her position. So tell me what you both are hoping that we can achieve with our community benefit programs in the future. And Tavia, we can start with you.
Yeah, sure. Some of the things that we're really focused on are around those priorities that I mentioned at the beginning of this time today. We really hope to continue to grow partnerships to support mental health and behavioral health, including substance abuse in our community. We know that is a huge need for all ages. And so as I'm looking, into 2022, I'm really looking at how does the community health investment team continue to work with the entire hospital, all the different service lines, and also with all of our community partners to support that work, because we know that we need to move forward, and we know that there's a huge need in that area. So not that our other priority areas aren't super important, and lots of work going in there too. But if I said, what is one of the things I'm really looking at and hoping to have some successes with, it would be around the mental and behavioral health outreach piece.
Okay, well.
Yeah, I think for me, the first thing I'm really focused on is access of healthcare, and really how do we change the access points of healthcare? It has to really stop being the main hospital. How do we create partnerships in certain areas of our communities, whether that's through civic centers or churches, to really drive various access points out there instead of it just being the traditional healthcare model? You come to us, whether it's a primary care physician office or an urgent care or an ER. I think we have to get out of our own way in that and really start seeking out new partnerships in those avenues to really drive healthcare changes and really going to get more into a preventative model of healthcare. The second thing for me is really about affordability. Healthcare is extremely expensive. The vast majority of our country can't afford it. And we're going to have to figure out some unique ways to solve that challenge and really drive down the cost of healthcare. And I think you're going to see a lot of unique things coming out of the Covenant umbrella, and really kind of how we're going to change what healthcare delivery is like in West Texas and Eastern New Mexico in regards to that. And then the last two, I think, are kind of unique, especially in the West Texas environment. We're going to have to try to drive some digital innovation into our marketplace. And, I think that will create some unique access points. If you look at our population, we have a very youthful population because we have such large universities in Lubbock, whether you're talking about Texas Tech or LCU or South Plains College or even New Mexico Junior College. And I think we have to really figure out how to deal with that age demographic, as well as our geriatric population, who still wants that direct connection point and that doctor who they can sit down and talk to about all their issues. And so I think we're going to have to diversify how we deliver healthcare and where we deliver healthcare. I think it's going to be really important to us. So it's using those two in concert to figure out the other issues for us to solve.
So one size does not fit all in healthcare.
Never has, never will.
Well, thank you guys both for joining us today, Tavia Hatfield and Walt Cathy. We appreciate you. To everyone listening or sending in your questions, we look forward to them in the future. If you're looking to learn more about the community benefit programs in Texas and New Mexico and our annual report, you can please visit providence.org/annual report and make sure to follow both Providence and Covenant Health on social media. Thanks for joining us today, everyone.